What is diabetes and what are diabetes symptoms and complications?
Hello and welcome to the Lancet Summary YouTube channel. In this channel, we create videos regarding hot and trending topics published by the Lancet journal. Dr. Salamati, would you please tell us what is diabetes and how it affects the body?
Actually, pancreas is located in our abdomen behind our stomach. And one of the main roles of the pancreas is releasing some special hormones including insulin. And insulin is responsible to regulate blood glucose. You know that without the presence of insulin, our cells are not able to use the glucose. And we have two types of diabetes. For the first one, there is no insulin. And for the second one, of course, there are some insulins, but they are not able to effect correctly.
What are the main symptoms of diabetes?
Without insulin or without acting effectively, we can have many problems in our body. At the beginning of the disease, the patients have some prodromal symptoms, mostly non-specific symptoms including polyuria, polydipsia, polyphagia, fatigue, and weight loss. To be more precise, in diabetes, we have glucose accumulation in the blood, and then glucose can transfer to urine, and in the next step, water can transfer from tissues to urine because of osmosis process, and they can cause polyuria or frequent urination. Also, we know that the tissues need to replace the water, and it can produce polydipsia or drinking water frequently. Likewise, although there is glucose accumulation in our blood, our cells are not able to use them, and a kind of food poverty happen, and the next symptom, I mean polyphagia or eating frequently, happen in the next step. And furthermore, as these cells are not able to use their food, people can sense and can feel fatigue, and in the next step they can lose their weight and we can have weight loss.
What are the diabetic complications?
The most destructive part of the disease is its complication. You know that these complications can happen in uncontrolled diabetics and can cause hospital admissions and even death. We can categorize these complications into two different groups, acute and chronic. In acute complications, we have hypoglycemia and hyperosmolar hyperglycemic state.
Would you please define hypoglycemia?
As I said before, there is a kind of metabolism disturbances in diabetics, and if the blood glucose of diabetics drop seriously, they can have some important symptoms including confusion, tremor, sweating, and in severe cases, we can have seizure, loss of consciousness, and even death.
What is hyperosmolar hyperglycemic state?
Hyperosmolar hyperglycemic state is another emergency state that can happen among diabetics. You know that if the blood glucose of the diabetics cannot be controlled, the blood glucose can increase gradually and it can cause some different symptoms including dehydration, stroke, unconsciousness, and even death.
Would you please tell us some chronic complications of diabetes?
You know that diabetes can involve almost all organs in our body. More importantly, some organs like eye, kidney, heart, vessels, brain, nerves, feeling, and also our mentality. So in the next video, we are going to speak about emotional and mental health issues of diabetics based on a recently published paper from the Lancet journal.
Thank you for your detailed explanations. This channel is here to talk about important medical topics, including new research from the Lancet journal. Don't forget to like this video, leave a comment below, and subscribe to our channel.